TMJD, temporomandibular joint disorder. This is a complex situation that can involve many different facets. As myofunctional therapists, we're concerned about the airway. And what we found is that those who have had retractive orthodontics, so headgear or elastics that pull the teeth back, can actually cause a compromised airway. It creates less space for the tongue, and when the tongue is forced back, it drops into that airway. And in order for your body to protect itself and keep that airway open, it's going to push everything forward, and it can really put a strain on those jaw joints. It can cause clenching and grinding and a lot of pain. Some orthodontists only look at the teeth. They just want to make sure that those teeth come together and they look really nice. They're less concerned about how the jaws come together. And so if they're pulling those teeth back and forcing that jaw into a very unnatural position, over time that's going to become stressed and strained and cause a lot of pain for you. If there isn't enough room for the tongue can actually be a very forceful object, and this constant pain and pressure and possibly an improper swallowing pattern can put a lot of strain on the jaw. You're going to use your accessory muscles of the jaw joint to do a lot of that swallowing instead of using your tongue. And so this again can cause issues down the road: pain, popping, clicking, crunching sounds. Your jaw may even lock open or close because it's just not hinging properly like it should. So the good news is the field of orthodontics is changing, and we're finding that retractive orthodontics doesn't work. So orthodontists now are much more focused on developing and protecting that airway, making sure that you can breathe effectively and that the jaw joints are coming together in a very natural, supportive way. So the great news is that there's even case study work on adults where we're finding adults can actually get expansive orthodontics. We never thought that this was possible, even just a few years ago, but we're finding that adults can actually create more space for their tongue and create a more symmetrical, symbiotic relationship between the jaw joints, the teeth, the tongue, and the airway. So if you have TMJD, if you have pain, popping, clicking, and you have some myofunctional impairment, talk to your myofunctional therapist. Get in contact with an airway supportive dentist and orthodontist, because if you can treat your myofunctional impairment, if your function can be improved, your TMJ symptoms can improve too.